Okay. Can you guys see the PowerPoint?
Sir, your mic is on again.
Okay, sorry. Hello, hello. Okay na?
Yes, sir.
Okay na po, sir.
Okay na.
Okay na,
Yes po.
sir.
Okay, can you guys see
Okay
the
na po, sir.
PowerPoint? Nakita na ka mat PowerPoint?
Yes,
Yes po,
sir.
sir.
Alright.
Yes,
Yes,
sir.
sir.
So, our topic for today is about the skeletal system. So, tapos na kita ng integumentary last week. Okay, don't worry, the integumentary system is not part of the practicals. Okay, it's only part of your exams, mga quizzes. So, dito. Pero, for the practicals, only, again, ang first topic natin ng mga tables and this one. Okay, so when we talk about the skeletal system, of course, we're talking about the bones. Okay, so a bone is a living tissue. Okay, and it constantly undergoes destruction and regeneration. So, when you say it constantly undergoes destruction and regeneration, it's like gingugubay, okay, and then bibuild otro. Okay, but I think destruction is actually not the best term to use because bagahin it yet term is baga nagiging lesser and bone. When you destroy something, baga naging lesser. But actually, when our bone is going through this process, okay, bagay yan, if you think about a house nga gin re-renovate, okay, so may dala parts nga gin tatanggal and then gin bubutangan hiyahin better nga materials. Also, nagiging mas maupay house, bigger, okay, mas mahusay kataon. So that's if you think about our bone, so ganito iyan nangyayari. Okay, that's what happens to our bone. Our bone is broken down in order to be rebuilt better. Okay, better hiya nga outcome. Okay, so it is composed of cells, collagen, water, protein, and calcium. So we have cellular components in our bone. We have I don't know if you guys can remember. I keep mentioning when you say osteo, this means that they are bone cells or bone osteo. Okay, kun osteo bone ito ya. So we have three cells. Okay, osteoblast, osteocyte, and osteoclast. Okay? So the osteoblast and osteoclast, okay? Heranga both of them are almost if you think about it, they are like rivals if you think about it, because osteoblasts they make new bone formation. Osteoclast they break down the bone resorption. Okay, osteoclast and osteoblast. So if you think about it, bagaran magkalaban. Okay, but actually they're actually working towards the same goal. Okay, they don't work against each other. Okay, if you read it, it's like they're working against each other. This one makes bone, this one breaks bone. So it's like they're working against each other, but actually they are working with each other in order to make the bone stronger. Okay, the other one, the osteoclast, okay, he removes the parts of the bone that are weak, okay, needs to be replaced, and then the osteoblasts, they're the ones who makes the bone stronger by putting more new bone. Okay, so they don't necessarily work against each other, they work with each other. All right, and then we have osteocytes. Okay, the osteocytes, you can think of them as the head of the bone cells, okay, or the boss. Okay, he is the one that regulates the activity of these bone cells. The osteoclast and osteoblast and osteoclast, both of them, they are regulated by the osteocytes. So bagalerang ginsusugo ni osteocyte na okay, do this, okay, do this. Okay, so it's like the boss. At the same time, it regulates the flow of minerals in and out of the bone. So minerals are very important in our bone. Okay, they make our bone stronger. Okay, storage of minerals. So the osteocytes, they're the ones who are in charge of that. So you can think of them again as the head, the leader of all these cells. So osteocytes, osteoblast, and osteoclast. Okay, wait lang. My camera was not on. No. Sorry. Okay. So did you get that first part? Okay. You cannot see me kanina, no?
Yes.
Tama ba? You cannot see me kanina.
Yep.
All
Yes,
right.
sir.
Okay.
Yes,
Oh,
sir.
yes,
Sorry,
sir.
sorry, sorry. I wasn't able to notice that. Okay, so yeah, those are the three cells. Okay. Then we have functions of our bone. Okay, just like your integumentary system, may functions. Our bones also has their functions. Okay, so may code Pepsi. Okay, that's the code Pepsi. Only nga double P. So first, it protects vital structures. So our organs that are inside our body, of course, they're protected by our bones. Okay, so one easy example for that is the ribs. Okay, our rib cage, they protect our lungs, they protect our heart. Okay, so of course our ribs are bones. Ba? So along with other organs, um, our bones protect them. Okay, from, of course, our bones are hard, strong. Okay, they protect them from external forces. Okay, like for example, if you are punched, okay, they don't easily um, damage your organs unless, of course, the force is too strong. Okay, but in general, they protect our vital structures in our body. Okay, just like your brain. Okay, we have the skull. Okay, protection, so that when you are hit in the head, okay, your brain is not easily damaged. Okay, unless, as I said, it's a strong force. Okay, super strong. Next, we have enhances leverage. So when you say leverage, this talks about kinesiology. Okay, pag second year niyo, when you go to second year, you have this subject called kinesiology. This is the study of human movement. Okay, so our bones helps, of course, in a big way on how we move our body and how we, for example, lift certain objects. Okay, so if our bone wasn't built like it is right now, so meaning there are different bones forming joints. Okay, our leverage to lift, for example, if you're gonna lift a heavy box, if your bone is only in a straight uh, line, kumbaga, diri mo hinabebend. You cannot bend your bone like this. If it's only like this, then it's really hard to lift heavy objects, diba? So, if um, you try to lift a box, for example, kaya nga nakasugad latim kamot. Okay? But since you can bend your bones, okay, you can flex your elbow, okay, you can put it closer to your body, you will put more advantage to your muscles, okay, using your bones, of course, diba? It's easier to lift closer to your body than it is when it is far from your body. Okay, that's the leverage there. Then it provides attachments. So when you go to second sem, okay, first sem pa man lang yun, ano? Pag second sem, we'll have the subject called anatomy for physical therapy. Okay, this one is gross anatomy, meaning general anatomy lang of the whole body. When we go to specific anatomy for PT, we'll talk about the muscles more. Okay, you're gonna memorize all the muscles in the body. I think there are over para ka 100 muscles. Okay, so those muscles, they have this thing called, manitaton good memorize. We memorize these things. Oina. Okay, or diba moina. That's the muscle, the name of the muscle, the origin, where does the muscle start, insertion, where does it insert in your body, the nerve supply, and the action of the muscle. So you'll memorize all of that. Okay, so our bones, they are the ones that contribute to these two, origin and insertion. So for example, if you have a bone here, let's say this is a bone. Imagine na lang yung bone ito. Okay, and then there's a muscle, right? Now the muscle, okay, the muscle originates in the bone and inserts in the bone. Okay, depende kon it depends on the name of the bone and what part of the bone. Okay, so in this subject, you won't necessarily have to memorize all the parts of the bones. Only names pa lang. Okay, only the names of the bones. There are 206 bones. So at the end of this topic right now, you can memorize all the 206 bones na. Okay, or if you cannot memorize them, at least you know all the 206 bones na. Okay, but there are also specific parts of the bones, like the head, okay, or the neck, okay, or the condyloids, the condyles. Okay, there are different parts of your bones, but you will learn that when you go to second sem. For now, as I said, just the names of the bones pa lang. Okay, so that's for the attachments. Then it provides support. Okay, so it's like the same lang with the different functions. Of course, when you stand, when you walk, when you run, or sitting down, your bones are your support. Okay, that you are stable, right? Then stores minerals. So I mentioned earlier, like water, protein, calcium, and other minerals. They are stored in your bone. Okay. And last, it is included as a landmark for palpation. So as I said, there are different parts of the bones, right? So when you're assessing, so if you're a physical therapist na, or even second year, third year, you are now starting to assess patients. Now when you're assessing patients with different injuries, you can use the bones as a landmark, okay, to palpate the different um, conditions. For example, they have painful shoulder, okay, or painful elbow. You can use the bone, okay. The bone in your arm is called the humerus, okay, right here. The bone right here is the humerus, okay. And then you can use the humerus, the different landmarks of the humerus. For example, the head of the humerus, okay, the condyles, the lateral condyle, the medial condyle, okay. So anyway, I'm just showing you an example. You don't need to memorize that yet, okay. So those areas of the bones, you can for example, you can communicate with your different um, medical professionals, okay. For example, nurses, or the doctors, or co-physical therapists. You will tell them the patient has a um, painful area in his lateral epicondyle of the elbow. So the therapist or the different medical professionals will understand that. Yung makakasabot ito nga, okay, I already know where's the painful area. A specific, right? So those are the different functions of the bone. Okay. Next, we go to the development of the bones. Okay, so of course, it aton bone they're literal na appear out of nowhere. Okay, they don't just when you're born, they're not ano lang already developed. Okay, they go through a process. Okay, so there are two types of development. We have the membranous and the endochondral. So these are ossifications. Okay, when you say ossification, the process of forming bone. Okay, so we have membranous and endochondral. So unahon tan membranous. So membranous can also be called intramembranous ossification. Okay, as I said, ossification is bone formation. Okay, ossification. When you say ossify, naging bone. Ossification is the process of forming bone. Okay, so we have intramembranous or membranous ossification. So what happens here? Okay, this starts from birth. No, conception to 2 months after birth. After birth. P with the line above is after. Okay, conception, meaning conception when the sperm and the egg cell nag-unite. That's conception na. So from that time until 2 months after birth, the membranous or the intramembranous ossification is happening. Okay, so what happens here? So of course, nag-unite na nimo sperm and egg cell. Okay, we have these things called the precursor cells. Okay, when you say precursor, bagain, it's like a requirement before you achieve something. Or for example, a subject, you have precursor subjects. Before you go to second year, you have to pass the precursor subjects. Like my subject right now is a precursor for the subjects in the next semester. Okay, so if you talk about precursor cells, okay, these are the cells that are bagan before they become transformed. Okay, kumbaga origin hira nga cells. So there are different type of precursor cells. One example is the mesenchymal cells. Okay, so by the way, when you go to second year, you have a subject called human growth development, where you're gonna talk about all about how the fetus is developed. Okay, hasta pag grow niya. Okay, so you will go more in depth about the. Ay, sorry, wala na to camera. What is happening? Wait. Okay, as I said, you will go more in depth about the development there, but here I'm just gonna talk about the development of bones. Okay, so you have mesenchymal cells. Again, these are precursor cells, meaning cells that are um, the origin of the different cells. Okay, so since we're talking about bone development, okay, these mesenchymal cells, for example, these red dots, just think about them as mesenchymal cells. Okay, once they receive blood supply, okay, nagkakada na rin blood supply, they will differentiate, okay, meaning nagtatransform na a differentiation or nag-differentiate ang cells, they will transform. Okay, when they differentiate, they will become, familiar na kami ni osteoblasts. Osteoblasts, ano to osteoblasts? What are the functions of the osteoblasts? Slide before, or 2 slides before. What is the function of an osteoblast? If you guys are listening.
Form
Make new
bones.
Yes, it
make new
makes
bones, sir.
new
Or
Make
bones.
new bones.
Correct. Okay, it makes new bones. So the mesenchymal cells, again the mesenchymal cells, when they receive blood supply, okay, nagtatransform they differentiate into osteoblasts, which are bone forming cells, right? So just imagine nga bone forming cells na osteoblast na imagine lang. Okay, osteoblasts. Now these osteoblasts, they will secrete this material or this substance called the osteoid. Okay, osteoid. So just imagine na lang ang nasekretera didihin, osteoid. Yung nga dots. Osteoid. Now, osteoid is unmineralized bone. And osteoid. Unmineralized bone. Meaning, diri pa talaga yung bone. It is, it can be considered na nga part of the bone or kumbaga, level yan bone nga diri pa fully functioning. Okay? It's not the 100% no capability it bone. Okay, amo to osteoid, unmineralized. Okay, so it's not 100% bone pa, unmineralized. Okay, so they will form this matrix, meaning nagkukumpulera. They go together. This osteoid, they go together. Diba matrix? It is a space filling. Okay, nakaka-fill yan space using different substances. In this case, osteoid. Okay, so they group together. They will be called the osteoid matrix right here. Osteoid matrix. Okay. Now, as the baby or the fetus develops, okay, of course, nagkakaroon yan more nutrition from the mother. Okay, if the mother eats healthy, of course. Okay, so as the baby or the fetus receives more nutrition, okay, this osteoid matrix, they will calcify. When you say calcify, it's like a synonym of ossify. Diba? Nasan ko ossification, bone formation. Calcification is the same, bone formation. Okay, calcify, ossify, naging bone, nagtiga. Okay, so this osteoid matrix, when they receive more nutrition, okay, of course, as I said, as nagpa-progress and fetus pag-grow, nagkakadian more nutrition. So nagka-calcify hiya. Okay, nagiging bone na hiya. Okay, if you can see here, it becomes the bone na. Okay, again, balik kita start from mesenchymal cells. Okay, when they receive blood supply, the mesenchymal cells will differentiate into osteoblasts. Osteoblasts will secrete osteoid, which is unmineralized bone. These osteoid will form an osteoid matrix. Okay, kumbaga, they go together. And then, once this osteoid matrix is mineralized or given more nutrition, it will calcify, okay, to make a bone na. Okay, now what bones are made through intramembranous ossification? You have it here, cranial vault and facial bones, or your skull, okay, your bones here in your face, they are made through intramembranous ossification. There's another one actually, clavicle. Your clavicle is made through membranous or intramembranous ossification. Okay? So your clavicle is your collarbone. Collarbone. Later I'll show you pictures of that, don't worry. Okay, so that's intramembranous ossification. Now we go to endochondral ossification. Where do you put this? Endochondral. So endochondral naman, from the name chondra, diba? Chondra. I mentioned in the tissues, chondro means cartilage. Okay, cartilage, chondro. Osteobone, chondro, cartilage. So here, you have a clue already. Endochondral ossification, so meaning it starts as a cartilage. So just imagine that this is a cartilage. Just imagine cartilage here. Okay. Now this starts, by the way, after 3 months of conception. So an intramembranous, it starts right away after conception. Endochondral, 3 months after conception. So after 3 months or 2 months, 2 to 3 months, nag-iiba-iba sources. 2 to 3 months. Okay, after conception, meaning adto pa sulod and fetus pa niya. So pag 3 months iti development, nagsi-start ng endochondral ossification up to 21 years old. Okay, some sources will say 25. Pero let's just stick with 21. Okay? So from 3 months after conception up to 21 years old. Okay? So maiha. Takes so long. Okay. Now, what happens? As I said, it starts as a cartilage. Now, in your cartilage, there are also mesenchymal cells. Okay? Mesenchymal cells. Now, same process. Once the mesenchymal cells in the cartilage receives a blood supply, they will differentiate into osteoblasts. Osteoblasts will make bone. Okay, bone forming cells. They will make bone. Okay, here. Now, in nga area, this area that I'm shading right now, it is called the primary ossification center. Okay, that is the primary ossification center, meaning that is where the bone forming started. Primary nga ni. Start. Okay, or first. Okay. Now, dere pa tapos. Okay. The mesenchymal cells on the top and on the bottom will also receive blood supply, and same process, mesenchymal cells will differentiate into osteoblasts. They will make new bone here. Okay, hot ends on the ends. Okay, ends. Okay, as the fetus develops, that will become a full bone na. Okay, so just imagine nga, this is a full bone, the one in the left, I mean the right side. So nagfuse ang mga bones and nagfo-form from the center to the ends. By the way, the ends, ito nga number 1 and number 2, these are called the secondary ossification center. Ang but nga primary, ini nga ends, secondary ossification center. Okay, meaning second laya, not the first. Okay, the first was in the middle. Alright, so as the child grows, okay, nade-develop an bone, okay, through endochondral ossification. Now, what bones are made through endochondral ossification? So, what the bones that were not mentioned in intramembranous, right here, dito already. Okay, so tutulo mo lang already, cranial vault, facial bones, clavicle. The rest are made through endochondral ossification. So you have your long bones, your pelvis, your vertebra, scapula, sternum, and ribs. Okay, so we're gonna talk about each of that later. Okay, so just take note na he endochondral the rest of the bones. He membranous, cranial vault, facial bones, clavicle. Okay, so you also have to remember the process on how they are made. Okay, so yeah, that is the types of development. Alright, now we go to sites sa imo long bone. Okay, long bone sites. You have your diaphysis, epiphysis, metaphysis, and the physis. Okay, so this right here, this picture on your right is a long bone. To be specific, this is your humerus. Humerus again, and bone din mo arm ini. In your shoulder, ini nga long bone din. Okay? That is the humerus. Okay? Now, the diaphysis is the shaft. The shaft boot nga, the center. So right here, diaphysis. Kita nyo the arrow from here to here. So this one right here is the shaft or the diaphysis. Boot nga, the center and bone. The epiphysis are the ends. Okay, so if you can see here, epiphysis, okay, from here to here, from here to here. That's the epiphysis, the ends. Now, we have your proximal epiphysis and the distal. Diba? If you guys already read the terms, proximal means closer, distal means farther. So, or kung wawaray-warayin mo, harani, proximal. Harayo, distal. So, gadla ito. Okay, so since the humerus head, humeral head, this is the humeral head. The humeral head is closer to the center of your body, your point of reference, okay, or your joint basically. So it's the proximal. The distal is at the end here. Okay, so that's the epiphysis. Then we have the metaphysis. The metaphysis is between the diaphysis and the epiphysis, meaning between the center and the end. So may the pa space. So I'll just erase these things. Okay, so the metaphysis is between the epiphysis and the diaphysis. So right here, may space. Okay, so here na end ang diaphysis, here na end ang epiphysis. So this space is the metaphysis. Same here. Here, the diaphysis ends. Here, the epiphysis ends. This is the metaphysis. Okay? And lastly, the physis. The physis has a lot of names. Okay? Pwede epiphyseal growth plate. Pwede growth plate. Pwede epiphyseal plate. Pwede physial plate. Okay? Pwede epiphyseal line. Physial line. Damot name niya. Okay? Iba-iba pero same meaning. Physis, epiphyseal growth plate, epiphyseal plate, physial plate, same meaning. This is where your bone grows or lengthens. Okay? Nahalabat mo bone in this area. Right here naman nga line. Okay? You can see here, epiphyseal line na niya tawag. Same leto. Okay? It is between the metaphysis and the epiphysis. So, if this is the metaphysis and the epiphysis, this line is in between them. Okay, so the physial line or the growth plate is very important, especially in children. Okay, kay growth happens more in children. Okay, diba when you're adult na, you don't grow anymore in your bones, right? So kids who suffer fractures or injuries, okay, in the physial line is prone to what do you call this? Abnormal growth. Okay, because your physial line, again, this is where your bone lengthens. If this line is involved in a fracture, okay, the growth of this bone is now impaired. Okay, as I said, di na lengthen ang bone. Okay, so you have to take note. Okay, so physical therapists, okay, you can educate, okay, your family, okay, or your clients if you have clients anymore. So your students pa lang, so family lang and friends. Okay? So very talaga delicate it bones hit bata, kids. So you have to take care of them. Okay? So yeah, those are the sites of a long bone. All right. Then we have the composition of a long bone from deep to superficial, meaning just imagine this bone you cut it in the middle, and then open mo, and then you look superiorly, meaning from the top you're looking in the cut area, okay, from the top. So you can see them. Okay, the medullary canal, okay, the pinakabut nga, the deepest. If you can see here, zoom in ko, this hole or this space in the middle, that is the medullary canal or cavity. Pwede. Okay, and then the inner hollow space, it is lined, okay, with the endosteum. Okay, right here, endosteum. You can see here, ginpeel and gray. Right, ginpeel out. That is the lining inside. Okay, And then, if you go outer, you have the diaphysis or the compact bone na din he. Compact bone. Yun, di ba shaft or the diaphysis, pretty gap, or the compact bone. You can see here, matiga. Looks solid, the bone. This middle area. Okay? And then you go outer, you will see the periosteum. Okay, this one, ginpeel again. This is the covering of the bone outside. Periosteum. Outside covering of the bone. Again, pinaka-deepest redundant. The deepest part, medullary cavity. Okay, may lining nga sulod, endosteum. Tapos compact bone. Tapos periosteum. Okay, so those are the layers from deepest to most superficial. Okay, again, medullary canal, endosteum, the cortex of the diaphysis or the compact bone, as I said, and the periosteum, the outer covering. Alright, next we have the Haversian system. Okay, Haversian system. The Haversian system, you can also see this, as I said, when you cut the bone, again, cut mo yung habot nga, then you're looking at it inside. So, for example, this is the bone, cut mo didi, then you're gonna look at it here inside. Okay, so the Haversian system, they are columns that are parallel to the long axis of the bone. So if you look at this bone parallel to the long axis, nasunod letter like this, for example, like this. So good later, parallel to the long axis. Okay, they're like that. Okay, so aminit erechore naman mga osteon hera or Haversian system tawag hera man. Right here, circle ini gin bring up here. Okay, may mga circle, they run parallel to the long axis of the bone. Okay, damoy tara. Okay, now what are these? Okay, these are important because they hold the blood supply, the nerve, the vein, okay, basically nutrition to the bone, also the cells. Okay, so first we have the Haversian canal. Okay, this is the central space. So if you look here, this picture right here, the central space, central space gapini. That is the Haversian canal. Okay, it may nagawas ng blue and red. That's the Haversian canal. Okay. Next we have the lamellae. Lamellae. It surrounds the Haversian canal. So I think there's a better picture right here. Lamellae. So this is the Haversian canal nga red. These circles surrounding it, they're called the lamellae. Okay? Erase ko lang. Sorry. Then you have your lacunae or lacunae. Okay? Spaces within the lamellae, storage of osteocytes, very important because they are the storage of osteocytes. So, the osteocytes are the regulator of the cells, the osteoblast, osteoclast, and also the flow of minerals in and out of the bone. So very important. So if you zoom in right here, okay, nakita ka mo yung mga dot nga black, those are lacunae. Tapos zoom in mo, amot itsura. This is how it looks like. They are osteocytes inside. Okay, and then you have your canaliculi. The canaliculi is the space between the lacunae and the Haversian canal. So if you try to draw it, so this one is a lacunae, right? This red one. Tapos iningabot nga central canal or Haversian canal. These lines that run like this, okay, these are the canaliculi. Okay, adipa canaliculi nera. Okay, so they're also important because they connect the lacunae to the Haversian canal, right? And then last, the Volkmann's canal. Okay, so if you see here, this one is Haversian canal, this one is another Haversian canal. The one that connects them is called the Volkmann's canal. Okay, try ko pag-erase para klaro. Ano pa yung color? Black na lang. So again, ini Haversian canal, this is another Haversian canal. The one that connects them is the Volkmann's canal. Okay, so blood supply to each other. Alright, so yeah, that is the Haversian system. Again, it's very important because that osteocyte right here, and then your nerve, your blood supply, your vein, okay, they are in these Haversian canals. Okay. So next we have the two types and bone inside, the cancellous and the compact. So the cancellous bone, okay, you can see it right here actually, cancellous. This one, this red things, okay, may dots. That's the cancellous bone, also called as the spongy bone. Ini nga red, ini nga reddish area. The compact bone is this one, nga waray red areas. Okay, solid. This one, cancellous bone. Okay. So, that's why they are red, because they are filled with bone marrow and blood vessels. Okay, added red bone marrow and the blood vessels. So that's why red dito yan picture, di ba? It is sometimes called the spongy bone. I already mentioned that. And they have trabeculae. Okay, so they are thin and consists of several lamellae with osteocytes. So again, important because they have osteocytes. So this one is an important note. Each osteocyte, okay, is associated with other osteocytes through the canaliculi. Diba? As I said, the canaliculi and run nga fibers like this. Okay. Usually there are no blood vessels. Okay. So the osteocytes must obtain nutrients through their canaliculi. So how does this happen? So right here. Okay. For example, ini nga lacunae right here. Lacunae nirang mga black dots. They don't have their own blood supply there because the blood supply is here in the middle. So how do they get blood supply? Through their canaliculi. These fibers, ini nga mga buhok nga gudti, lines that run towards the central canal. Okay, towards each other. Okay, also from the central canal. So they will get their blood supply through their canaliculi. Okay, very important. Okay. Zoom in, hit canaliculi right here. Man, aman canaliculi. Didi may osteocyte here. See, they run perpendicularly. What? Okay. All right. So here again, another picture. May the artery, vein, and nerve, diba? Amoy nin canal. Habot nga if you complete the drawing. The canaliculi, okay, they run from the middle towards the lacunae. Okay. All right. So that's it. Then compact bone, amoy nin solid. Okay, it is denser and has fewer spaces than the cancellous bone. The blood vessels enter the substance of the bone itself. Okay, so they don't have problem with the blood supply because the arteries enter this part of the bone itself. Okay, and the lamellae of the compact bone are primarily oriented around the blood vessels, meaning they're rich in blood supply. Okay, so same linear story of vessels, blah blah blah, contained within the Haversian canal. Central canals are lined with endosteum. I already showed you earlier. Okay, endosteum. And then my blood vessels, nerves, and connective tissue. Then lastly, an osteon or an Haversian canal consists of a single central canal. So these are just things that you have to take note. Okay, during exams. Okay, pwede ka mo i-confuse. So just take note compact bone, the difference of compact bone and the cancellous or the spongy bone. Alright. So we're done with the types and bones and the development, the functions of the bones. Now we go to the names of the bones. Okay, there are 206 bones. Okay, 206. At the end of this topic, as I said, you will know each of those 206 bones. Okay, so the skeleton, okay, can be divided into the axial and the appendicular. The axial is the middle. So kumbaga ini. Axial ini. And the sides, the rest are appendicular. Okay, so we'll start with the axial skeleton. Right, so we start from the top, of course, the skull. So the skull consists of the cranial bones, facial bones, and the temporomandibular joint. So later we'll talk about that. Okay, so the skull has 22 bones in itself. Okay, as I said, the face, the head, the mandible, okay, adaha, skull, can be also called the cranium, same letra. Now the cranium or the skull has cranial bones plus facial bones. Okay, so we'll talk about the cranial bones first. Okay, by the way, the cranial vault is also called the calvarium. Bayan ka mo malipat during quizzes or exams. Nakabutang la dito, what are the parts of the calvarium? Same like yet cranial vault. Okay, so the vault is the upper portion of your skull. Okay, the lower part is called the base. Okay, so base, syempre amot imo ubos. You say base, it's like the foundation or the lower area, the base. Then the upper is the vault. Why is it called the vault? Because there are organs inside. So storage, surudlan. Okay, like your brain, okay, or your eyes, okay, are the upper part, right? So, last one. All bones except the mandible are connected by sutures. So, what are sutures? Sutures are joints nga immovable. Immovable joints. So, all bones kono in your skull are connected by immovable joints except for your mandible. So, let's look at that right here. So, if you see these lines nga nagzigzag or these lines na lang, these are sutures. Joints inera. A joint is a connection between two bones. So these are two bones connected by a suture, right? So these are immovable. Of course, you cannot move your joints here in your head because the brain is inside. Kung nagmo-move an imo bones here, delikado because you can injure the brain. So dapat solid ya. Dapat diri na move, right? Now, all of them are connected by sutures except for your mandible. This is your mandible, your jaw, right here. The joint here of the mandible is not a suture because you can move it. But while I'm talking right now, my jaw is moving up and down. I go open and close. You're eating when you drink water. Okay? So diri a suture. It is a synovial joint, a moving joint. So that's a trivia lang. All of the joints here in your head or your skull are immovable or sutures, except for your mandible. This is called the TMJ. Okay? Later you will know why. So first, let's talk about the bones in your cranium or cranial bones. Ani kita. There are 8 cranial bones. There's a code PT-FOS. PT-FOS. Okay, every letter again has a corresponding meaning. So PT-FOS. So let's start with P, parietal bone. The parietal bone is the top bone ay mo head. Okay, here, right? Ikakaptang ko. This is the parietal bone. Okay? T, temporal. Sides. Okay, didi side. Temporal. Ginduduha ko because duha ra. Left, right. Same with your parietal. Left, right. Okay? O, PT-FO, occipital. Okay, occipital is the back. Din yung likod. The back bone in your head. Hindi kakaptang ko yan na. PT-FO. E, ethmoid. Okay, this is inside hymo orbit or orbital canal. Okay, ato sulod. Diri ko tiya matakaptan because you have your eyes, of course. And then you have your S, sphenoid. Okay, adia side din. Gutila. Not like your temporal which is big. Your sphenoid is gutila. It's right here. Small. Okay. So, by the way, FOS. Wala ko may ka ng F. Okay. Frontal. Agtang. Your forehead. Frontal. That's why you do not say forehead anymore. You say your frontal area. Okay. So, another view here. Parietal. This is your frontal. By the way, anterior niya. Posterior. Occipital. Okay. And temporal din nakikita. You cannot see the temporal here. Alright. So, those are the cranial bones. PT-FOS. Okay. Duha nga parietal. Duha nga temporal. And the rest tag-usa na lang. One frontal. One occipital. One ethmoid. And one sphenoid. Okay. By the way, may trivia, ethmoid and sphenoid. Ethmoid is the second most difficult to visualize. The sphenoid is the most difficult bone to visualize, meaning hard to imagine and really understand how it looks like. Because you can see here, this is the sphenoid. You say, oh, ba't easy man to visualize. But when you go here, okay, this is the sphenoid again, a sphenoid. This is still the sphenoid. You can see, has side, bagayan na, sugad. Pero, when you look through the eyes, or the orbit, pag sulod mo, nasugad na niya. Okay, so it's hard to visualize from here to here. Okay, so you cannot really imagine or see what it looks like until you open the skull and then you take that bone. Okay, so nasugad hiya, and then once it goes in, it will go small and then go like this. Okay, so it's hard to visualize. So the ethmoid is also hard to visualize. Right here, this is the ethmoid, meaning a yellow. Ato sulud. It's hard to visualize because it's inside. Okay, that's the main reason. Okay, you cannot even see the ethmoid from here. Alright, so those are the trivias for the ethmoid and the sphenoid. Okay, so we're done with the cranial bones. Again, PT foes. Okay, PT foes. Then we go to the facial bones. Facial bones. By the way, kailangan nyo ma-memorize. Marit akong naging pa-practical ng mga bones. Okay, facial bones. So the facial bones may dagapya code nilapa si mama V. Okay, that's the code nilapa si mama V. Magan si mama Vilma. Okay, kamunat bahala ito. Basta mo itong code. This is the code that was given to us when I was still a student. Okay, and I brought that until board exam. So if you guys want that, then you can use this code. If you want to make your new code or another code, then it's fine, of course. Okay, so this is the code that I was used to using. Nilapa si mama V. So every letter again may corresponding bone. Okay, nilapa si mama V. First nasal, nasal. Okay, right here. Pero next ni inferior nasal concha right here. Ato sulud. You cannot see it. It's inside. Inferior nasal concha. Nil lacrimal. Okay, lacrimal. It's right here. Okay. Nila pa. So palatine. Palatine right here. Okay, also in the nose area. Nilapa Z zygomatic. Cheeks. The cheekbone. Okay, zygomatic. Nilapa Z mama. Mama. Maxilla. Yun yung dinhinga bone. And then the mandible, your jaw. Okay. And then last, the vomer. The butnga. Ano din here? Okay. Nilapa si mama V. You have to take note, hinot paired and hinot dere paired. So, kanin hapiti foes. These are cranial bones. Adit paired. Paired. Tapos tag-urusan na lara. Hay mo nilapa si mama V. It only not paired. He mandible and he vomer. The rest are paired. Oh. Paired. Okay? So, take note of that. Right? So, cranial bones, 8. Facial bones, 14. Okay? So, take note. Right? Then we have, oh, by the way, this is just a picture. If you guys want to, visualize it more, you can read the bones here. But these different parts, you don't need to memorize that yet because, as I said, mga general or gross anatomy pala ata. So, just the names of the bones, not the different parts. Like the fissures, the foramen, not yet. Okay? Only the ones that I mentioned. The PT foes and the nilapa si mama V. Pag abot ta second sem, amo na ito't mga specific parts of the bones. Okay? Out of our scope pa ito yan ang mga specific bones. Specific parts. Alright, then we have the auditory ossicles or the bones inside their ear. We have bones inside their ear. There are 3. The malleus, the incus, and the stapes. Trivia. This right here, the stapes, is the smallest bone in your body. Smallest bone. Kainan ka nga ni, what is the smallest bone in the body? Stapes. Okay? We zoom in. Amunara, malleus, incus, stapes. Okay? Smallest bone in our body, stapes. So these are important because they transmit the vibration. Okay, para we can hear the sounds. So the sound waves will enter your ear, will go to the eardrum, Okay, producing vibration through the bones to the cochlea. The auditory nerve will catch it, going to the brain. Now we will understand what we heard. Okay, so when we go to vestibular, we will talk more about that. So for now, just know bones man lakata, the malleus, incus, and stapes are also bones. So there are 3 each side, so 6. Okay, 3 on the left, 3 on the right. Okay. Okay, we're done with the skull or the head. Now we go to the spine, the vertebral column. So the vertebral column, namuti mo spine, okay, the one that runs in your back. So it can be divided into cervical, thoracic, lumbar, sacral, coccygeal. 1, 2, 3, 4, 5. Okay. So these are different parts of your vertebra from top to bottom. Cervical, thoracic, lumbar, sacral, coccygeal. So if you can see here, cervical, thoracic, lumbar, sacral, coccygeal. So 7 bones in the cervical, 12 in the thoracic, 5 in the lumbar, 5 ha sacral but it fuses pag adult mo na to 1. 4 ha coccygeal na fuse into 1. Okay, so in total ha adult 26. Habata 33 because wala pa mag-fuse. Okay? The normal length of the vertebral column is 72 centimeters for males, 62 for females. So that's just an average, of course. Dito tiya fixed nga. Lalaki permi 72. Okay, that's just an average. Male 72, female 62. Okay? So this is what your vertebra or your spine looks like. You can see here cervical, thoracic, lumbar, sacral, ini nga nasugad, tapos coccyx ini nga end. Okay, if you can see, may the curves it aton spine. And these are very important. Ano yung nga curves? Okay, so how do you name these curves? If this is anterior, lateral view niya, when you say lateral view, side view. This is anterior, this is posterior. If the curve is like this, meaning anteriorly it is convex, posteriorly it is concave. Convex nga ni na butol, concave nga ni na cave, na sulod. Okay, so anteriorly na butol ya, so convex. Posteriorly it is concave. Okay, this is called a lordosis. Lordosis itawag kaya, lordosis. Lordosis or lordotic curve para letter at meaning. Now if the curve is like this, anteriorly it is concave, posteriorly it is convex, it is called a kyphosis or kyphotic curve. Lordotic curve, kyphotic curve para letter at meaning. Okay, now if you look at your spine, your cervical region is a lordotic curve. Kita mo, anteriorly it is convex, posteriorly it is concave. This is a lordosis or lordotic curve. Your thoracic spine, anteriorly it is concave, posteriorly it is convex. This is a kyphotic curve or kyphosis. Lumbar, anteriorly convex, posteriorly concave. This is a lordosis. Your sacrum, anteriorly it is concave, posteriorly it is convex. It is a kyphosis. Your coccyx doesn't really matter because it's just that tip. Okay, so basically here cervical, thoracic, lumbar, sacral, it aton ginkikitat curves. Okay, now your kyphotic curve is the primary curve, meaning when you are born, your thoracic vertebra is already like this. Kyphotic na tiyang adaan normally. Now as we develop, as we grow, our secondary curve, okay, na-form na. That's why secondary. This is your lordosis. So your cervical lordosis starts at 2 to 3 months. Okay, 2 to 3 months after birth, of course, because this is when the baby raises his or her head. Nagahangad-hangad na niya. Look up. Ba? Na-look up na yan. So, when that happens, your cervical spine makes a lordosis. Okay? So, if you try to look at it, na-curve niya front, forward, tapos kyphosis like that. Of course, there is good ka O8 curve, pero emphasize ko lang so that you can see. And then your lumbar lordosis naman develops at 10 to 12 months because the baby starts standing and walking. So, of course, when you're walking and you're standing, gravity forces going down na develop and curve, lordosis. Okay? Nasugad. And then, normal posture naman. Okay? If you're standing, normal posture, may ito talaga lordosis. Okay? May space din yung lumbar area. Kung flat it imo back, then that's impaired posture. You have tight muscles or you have maybe conditions. Okay? Pwede may da problem ano mo bones. Okay? Specific or serious conditions. But normally, it's just for tight muscles kung impaired din mo posture. Okay? So that's the lumbar. And then the sacral, same. Primary curve man diya. So when you're born, it's already like that. Okay? So take note ka mo when nade-develop ang cervical lordosis and lumbar lordosis. Okay, so that's your vertebra ha. 7 ay. You have to take note. 7, 12, 5, 1, 1 for adults ha. So pereni 26 ba doon nakabutang kanina? Am I right? 7, 12, 5, 1. Yeah.
Yes, sir.
Yes, 26. So 26 bones in your vertebra. Kita niyo usa-usa. 1, 2, 3, 4, 5, 6, 7. You can count them. So, amrat here. Okay? So, another picture for your vertebra. Same like here. Okay? This is anterior view. Anterior view ni. See from the front. And this is no, this is posterior view. This one is posterior view niya, not anterior. And this is lateral view. Okay? Alright. So we're done with the vertebra. Okay, the vertebra is very complex by the way. Very complex. Damo itong durot yung malalearn dito. Pero as I said, gross anatomy pala kata. So, just the general knowledge for the vertebra. Okay? If we dive into the vertebra, that's a whole nother topic by itself. Okay, na naabot 2 hours just for the spine. Okay? So, for now, bones man lang. So, just take note and number the amount of bones there. Okay. Then we have the rib cage. Where's din the ache siya la? But nga lagyap. The rib cage or ribs. Okay, so the rib cage, okay, it involves the sternum and 12 pairs of ribs. So, 12 on each side, 24. Plus the sternum, that's 1. Okay, so the sternum, may daniya 3 parts. The manubrium, the body, and the xiphoid process. You can actually touch your manubrium. If you touch your chest, nabut nga. May nabutol. Ito nga na bump. Okay, a slight bump. That's your manubrium. If you're touching your chest right now. Okay. Now, that's part of your sternum. Right? Then you have 12 ribs. The first 7 ribs are called the true ribs because they attach to the sternum. If you can see 1, 2, 3, 4, 5, 6, 7. They all attach to the sternum. That's why they're called true ribs. The next ribs are the floating false ribs. 8, 9, 10. Kind of false because they don't attach to the sternum itself. They only attach to the 7th costal cartilage. When you say costal, guys, ribs ito. Costal. Bain ka mo malipat Costal. Another term. I think it's there in the tables. Not sure. Costal. Costal nga ni ribs ito. So, when I say it attaches to the 7th costal cartilage. Okay? So, look. 7th rib may daniya cartilage. The 8th, 9th, and 10th, they only attach to the 7th cartilage. Tapos, tikad to na sternum. Okay? So, they don't really attach to the sternum, but only to the 7th cartilage. And then the 11th and the 12th ribs, they don't have an attachment. They're called the floating ribs. 11 and 12. So, if you can see, this is 11, this is 12. They don't have an attachment. 11, 12. They are floating. Okay? So, true ribs, false ribs, and the floating ribs. Take note. So 12 on each side, 24. Then you have your sternum as 1. Okay. Now we go to the appendicular. Or tapos na ka ng eggshell, but nga. So skull, 22 bones, di ba? Tapos may daka mo auditory ossicles on each side, 3 plus 3. So 6. Then you have your vertebra, 26. And then you have your ribs, 24, kay 12 on each side, plus sternum. Ba? Then we have the appendicular skeleton. So the sides na kata. So for the shoulder and the arm, we have the scapula, clavicle, humerus, radius, and ulna, carpals, metacarpals, and phalanges. We will talk about each one of them. Scapula. This is also called the shoulder blade. Okay, but we don't really call it shoulder blade here na. Pero layo, bangin marama kamat shoulder blade. That is the scapula. So if you look here in the first picture, ano, hanad to. Oh, no. It's on top pa ngayon, sorry. Here. Minute scapula. That's your scapula. Okay, bagan blades. Siya, shoulder blades itawag. Okay? There's 2 of them. Okay, this is very important, your scapula, because it is the one that articulates with the humerus. Nasin ko humerus, di ba, meaning shoulder bone nimo. When you say articulates, nagdidikit. They not really fuse because may space man nara, but they're the ones that go together to make a joint, the shoulder joint. Okay, so when you're moving your shoulder, okay, up, down, flexion, extension, abduction, adduction, okay, it happens here. Okay, so the connection is between the glenoid, that's a part of the scapula, and the humerus. That's why this is called the glenohumeral joint, GH joint. The shoulder joint is also called the GH joint, glenoid. Okay, right here. This part nga nag-articulate. This is the scapula, diba? This part where the humerus attaches is the glenoid. Okay, so that's why it is called the glenohumeral joint or the shoulder joint. So that's why your scapula is important. So when you move your shoulder, your scapula also moves with your humerus. Okay, together. If your scapula is injured or it doesn't move, then your shoulder movements will be impaired. Okay, that's why the scapula is very important in your shoulder motions. Okay, let's go back. Now we go to the next one, the clavicle, I believe. Yeah, the clavicle. The clavicle, as I showed you earlier, that's the collarbone. It braces the scapula. So I think it's right here. The one. Clavicle, right here. These 2 slender bones. Fun fact, the clavicle is the most commonly fractured bone in your body. The clavicle. This right here. You will learn why when we go through our topics, but for now, just take note, the clavicle is the most commonly fractured bone, mainly because look at it, it's very slender, may manipis. Okay, next we have the humerus. Makadamo ko na gin balik-balik. This is your arm, meaning a bone din here, right here. It's your humerus. Okay, it articulates with the scapula to make the shoulder, and with the radius and the ulna, not only the ulna, to make the elbow. So here in the elbow. Now let's talk about the elbow. Added at radius and ulna. Now look at the picture right here. Okay, radius, ulna. Now if you look at your forearm, there are 2 bones there. There lati usa nga bone. Okay, dire mo nakikita nga duhat bones, di ba? Pero duhay tot bones dira. The radius and the ulna. How do you remember which is which? The radius is on the thumb side. Take note. Hay mo thumb side, ini nga bone right here is the radius. In your pinky side, the bone here is the ulna. Radius may thumb side, ulna may pinky side. Take note. Bisa mo balik taron, same. The radius is right here on the thumb side, the ulna is on the pinky side. Okay, so look, radius adi may thumb side, ulna may pinky nga side. Right, same goes on the other side. Radius adi may thumb side, ulna may pinky nga side. Take note. Okay, di ka mo pwede malipat ito. Alright, So the humerus, you can see here, this is the elbow joint, articulates with the radius and the ulna, both of them, to make the elbow so that you can move like this. Okay, that's your elbow joint. All right. Now we go to the carpals. Carpals. Adi na kata may wrist. Kamot na. Now if you look at your picture here, the carpals, amoy nga mga bato. These small ones, they look like rocks. Okay, if I'll try to circle them, nara. Carpals in dinhi. Okay, adi pa, carpals. Now there are 8 carpal bones, 8 on each side. So 8 left, 8 right. Okay, now they have their own names. The carpal bones has their own names. Iba-iba't erangaran. Okay, so there is a code for that. Now, if you look at your left hand, kita ka mo, face and palm to your face, towards you, nasugad. So, thumb side ni mo lateral, di ba? Lateral, away from the midline. Medial, hay mo pinky side. Ini nga pinky side, medial ito kay towards the midline. You have your distal row, proximal. Distal harayo, proximal harani. Now, as I said, there are 8 carpal bones. So, amoy tara pagkasunod-sunod. Okay, 8. May code ito ra, each letter. Okay, so the code is, as I said again, amon gitot do amon. Okay, this is the easy code for me. You can make your own code. Okay, this is kind of bastos. So, if you guys don't want the code, then you can make your own codes. Some lovers try positions that they cannot handle. Okay, again, some lovers try positions that they cannot handle. That is the code for the carpal bones. Okay, you can make your own code if you're not comfortable with that code. Okay, by all means. But as I said, amon gitot do amon. And anyway, if it's usually bastos nga net code, mas masahin ma-remember. Okay, that's just how we work. Okay, some lovers try positions that they cannot handle. Okay, so each letter has a meaning. Each letter has a meaning. S, that is your scaphoid bone. L, that's your lunate. Triquetrum for the T. Pisiform for the P. The other T haigbaw na adin ka taigbo ha. And adin na kata din eh. So ani nga SLTP, some lovers try position, scaphoid, lunate, triquetrum, pisiform, trapezium, then trapezoid, then capitate, then hamate or hamate. Just kidding, hamate ito. Okay, so those are your carpal bones. Okay, now in order to kasurat ko era from lateral to medial, proximal row, distal row. Okay, bahin ka malipat. It question ito usually for basic gross anatomy. Laterality, meaning hanging aside. So masaring, the question will be, which carpal bone in the proximal row is the most lateral? Okay, anong question? Which carpal bone in the proximal row is the most lateral? So you can see here, in the proximal row, this is the proximal row, which carpal bone is the most lateral? So the answer will be scaphoid. Okay, scaphoid. Masaring, in the distal row, which carpal bone is the most medial? Okay, in the distal row, which carpal bone is the most medial? Hamate. Okay, or masaring, all of the following are parts of the distal carpal row except the distal carpal row except. So you have to know the distal carpal row: trapezium, trapezoid, capitate, hamate. Okay, so you just memorize this. Some lovers try positions that they cannot handle. Those are the carpal bones. Bisan mo tiya balik taron. Okay, this is your left hand. Ini nga akong gipakita. Left, ito left. Even if you go right, same lagi ito. So if you go right, lateral lot diri kay thumb side, lateral. Medial side, pinky. Yeah, pinky medial side. Distal, harayo, proximal. Same. Some lovers try positions that they cannot handle. Same. So, question kanina, high mo proximal row, which is the most lateral? Same. Scaphoid. High mo distal row, which is the most medial? Same. Hamate. Okay? Same leto. Even if you go left, go right, it's the same. Okay? So, take note. Alright. Those are your carpal bones. 8 on each side. And then we go to metacarpals. Metacarpals are easy, they don't have names. Don't worry. Metacarpals are just metacarpals. There are 5 metacarpals right here. Metacarpals, there are 5 metacarpals. So, tera pangaran la. First metacarpal, second metacarpal, third metacarpal, fourth metacarpal, fifth metacarpal. Okay, there are 5 of them. So, if you see here, yun, metacarpals inhera. The long ones. If you look at your hand, the carpals are here, right? Auditory. Some lovers try positions that they cannot handle. Auditory. And then there are 5 metacarpals. So the one is 1 here, 2, 3, 4, 5. Metacarpals ito ra. Okay, 5. And then we go to the phalanges. There are 14 phalanges. It's very easy. Phalanges are your fingers. Ini nga fingers. 14 hara. And you can count them just by looking at your hand. You look at your hand. May da mga lines, di ba? Ginhatag na yung answer. How many phalanges? You count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14. Ginhatag na mo, gimbagisan na. It's already there. Given. Pagkita mo, you look at it. 3, 6, 9, 12, duhalat already, 13, 14. Okay? So, you have 14 phalanges. Now, your phalanges, they don't necessarily have names, but an area. So, you already know the proximal and distal, right? So, again, proximal, harani, distal, harayo. So, here, ini nga ani din hiya obos, these are your proximal phalanx or proximal phalanges. Proximal ini, proximal ini, proximal ini, proximal ini. The middle is by the name middle. Middle phalanx. Middle, 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 middle. Okay? Distal. Pinakarayo. Distal, 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 distal. Di waray middle. So, proximal, distal. Okay? Easy lang. And may ngaran la talaga in carpals. Some lovers try positions that they cannot handle. Just memorize that. Ay damo na new code. May daka mo PT foes. May daka mo nilalapas di mama V. You have your CTLS for the vertebra. And then you have your some lovers try positions that they cannot handle. Okay? Damo na yung code. So, I mean, these codes will help you so that you will not really memorize so many. You just need to know the letters. Then just try to remember the names. Okay. And then we go to the lower X. So 14 on each side ito 14 on each side. Okay, 14 didi, 14 didi. Pareho latara. Now we go to the lower extremity, hip and leg. So first the pelvis or the pelvic bones. So if you look at this picture right here, this is the pelvis. Kunahin ta kon mouse na circulate. Inhi. Now the pelvis, there are only 2. 1, 2. Dohalatara. But they have 3 parts. Okay, they can be divided into 3 parts. The ilium, which is the top part, the ischium, which is the bottom part, where you're sitting right now. If you're sitting down, that's your ischium, or to be specific, your ischial tuberosity. That's where you're sitting right now. And then you have your pubis, the butnga, pubic. That's why it's called the pubic area, pubis. Okay, pero duhalatara nga bones. So the ilium ischium pubis makes 1 pelvis. The ilium ischium pubis in this area makes 1 pelvis. So that's 2. Okay, 2 pelvic bones. Okay, and then we have the femur. The femur, trivia. This is the femur. This is the longest and largest bone in our body. Femur. What is the smallest bone in our body? Guys, smallest bone.
Stapes.
Stapes, sir.
Stapes, correct. Okay. So the longest naman or the largest is the femur. Okay, imo hip or thigh bone. Okay? Inhi. Now, you will question, sir, it vertebra, dere amot longest, halaba man yan. O, taan nyo, halaba. Ha? Well, the vertebra is not one bone. Diba? Iba-iba. 7, 12, 5, 1, 1. Bulag-bulag. These are small bones. If you can see here, that's one bone. It's one bone. Okay? They are just connected by cartilage or an disc dinhi habot nga. So that's one bone nga, itong rectangle, that's one bone, another bone, that's another bone. So they're not necessarily one bone nga long. Okay, these are small bones, okay, connected by cartilage. Okay, all right. Next we have the patella. Okay, you can touch your patella actually. Aday mo tuhod, your knee, your patella, ini din sesamoid bone. You can touch it, mo knee. Then you have your tibia and fibula. It's almost the same as your radius and ulna. You can see your radius and ulna here, diba? Duhag para. In your leg, duhag at bukog, the tibia and the fibula. So the tibia is way bigger than the fibula because it receives weight. Okay. Tungod nga nakaka-receive yan weight, naghilat na dako. Okay. And fibula doesn't receive weight, so it doesn't grow. Okay. It's only there for stability. Now, I don't know if you have discussed na the Wolff's Law in your physiology. Okay, Wolff's Law states na if your bone, your bone will adapt to the forces that are given to it. Meaning, if you put more force into a bone, more stress into a bone, it will grow bigger. If you put less stress, you don't exercise, you don't give it weight, it will not grow. Okay, so in this case, the tibia receives weight in their body. Normally, ada talaga nagit weight. So, he receives a lot of stress. It receives a lot of stress, a lot of forces. So, as we grow, the tibia grows. The fibula doesn't receive weight. Okay, so it doesn't grow. That's Wolff's Law. Wolff's Law. Ambot kung discuss na ito. Wolff's Law. That's Wolff's Law. Okay, they will adapt into the forces that are given to it. Okay, actually that doesn't only apply to the bone, pero in this case bone man kita. So yeah, Wolff's Law. All right. Next we have the, so tapos na katahan tibia and fibula, right? Next we have the tarsals. So kung may nakata carpal sa kamot, we have tarsals liwat hatiil. So ay inira. Of course they're bigger because they receive weight. Okay, tarsals ito tawag era. There are 7 tarsals, namely, sort ko nala, waray code. Sorry, talus, calcaneus, navicular, cuboid, and then uniform. I think uniform. 1, 2, 3. So if you count them, 1, 2, 3, 4, 5, 6, 7. There are 7 of them. Talus, calcaneus, navicular, cuboid, and the cuneiforms 1, 2, and 3. Right? So those are the tarsals. And then the last part, same lang. Metatarsals 5, phalanges 14 on each side. Okay, do not be confused. Look, it says metatarsals, tarsals because feet, yeah, foot. Okay, ha kamot, ha hand, metacarpals. Do not be confused because carpals, carpal bones, tarsals, metatarsals. Okay, ha tiil nga ni or a foot, metatarsals, a hand, metacarpals. MCP, metacarpals, kamot. MTT, metatarsals, tiil. Okay, so phalanges same letter, yeah, same. 14, proximal phalanx, middle phalanx, distal phalanx, same. Now if you add all of those, bones, those are 205 pa lang. 205. Medyo pa usang waray ko ka-mention. May 206 at tunga tanan nga akong discuss pala, the ones that we have talked about. 205. Then there's the hyoid bone right here. Hyoid bone. Nalilibot nga. Okay, that is the 206th bone. Okay, so now you know all the 206 bones. Okay, so you just need to memorize all of those. Anyway, as we go continue discussing, it will just come natural to you. Okay, you will just memorize all of them. Pero kami practicals kita next week, so I'm gonna rush you guys to memorize it. Okay, so skull, 22 bones, diba? Skull, PT foes, parahan cranial bones, and then facial bones, nila pa si Mama V. Okay, then you have 3 on each side of your ear, diba? Ossicles, auditory ossicles. You have 26 vertebral bones. You have 12 is 1. Okay, then you have here tagda mo latakin mo butang ha. So 8, 5, 14. Same, 8, 5, 14. Meaning 8 carpals, 5 metacarpals, 14 phalanges. Then in your lower extremity, niliha leg, 7 tarsals, a foot, 7 tarsals, 5 metatarsals, 14 phalanges. Okay, same on each side. Okay, so together with the long bones, yung mga humerus, radius, ulna, blah blah, na result ito to 206 bones. All right, are we clear? Klaro ba?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
Kaya la?
Yes.
Kaya la niyo? Kaya?
Kakayanan, sir.
Kaya
Kakayanin.
Okay.
Kakayanin.
Ito because this is our course. Okay, is that course? You have to memorize all of these. Okay. As I said, you can help yourself by using the codes, the acronyms, the mnemonics. Okay. Alright, so we're done with the bones. Pero di pa tapos na topic. Ay, di pa kita tapos ang bones. Joke lang. Ay, basic na lang ni long bones. Itera ko no itsura cylinder-like. They're longer than they are wide. So for example, at humerus, long bones, humerus, radius, ulna, MCPs, femur, tibia, fibula, the ones we mentioned earlier. Mga kaglaba, long bone. Short bones naman from the name, short. They're cube-like. For example, carpals and tarsals. Diba? Carpals, ba't mga bato? Nasa yung kayo. Okay? Flat bones, they are thin and curved. Okay, flat. So, your sternum is flat. If you remove this is your sternum. If you remove this, that's flat. Your scapula, shoulder blade, asugad la ito. Cranial bones, your frontal, your parietal, your temporal, your occipital. If you remove them, they are flat and curved. Okay? Sesamoid, your patella. And aday mo knee. Okay, and then lastly we have the irregular bones. Okay, they don't really follow a shape. They're complex, like your vertebra, imo spine. Okay, and imo cervical. Look at, if you look here, this is an example of a vertebral bone. Ini man. Okay. Wait, let me guess what this is. This is the cervical vertebra. This one. I was thinking kung ano dun niya. Cervical. Okay, because triangularity spinal canal. Okay, anyway, you will learn that pag-abot niyo at second sem. Pero yung papakita ko lang yung complex vertebra. Iba-iba't yung shape. Each of them ang itsura. Superior view niya from the top view. You can see. Tapos iba't itsura thoracic. Okay, iba't itsura lumbar. Okay, so nag-iiba-iba. That's why they are irregular. All right. Kaya pa niyo guys. We're going to move to joints. These are joints. Joints na kita. Pero don't worry, di rin nini buligit practicals. Okay? Pero buligin it exams, quizzes, exams. Pero practicals dire. So here, this is actually already we're going ahead na hit joints. Pero I need you guys to learn this already para basic lang kasi niya. Joints, very basic, and it's easy to understand the joints because we just talked about the bones. So there are 3 types of joints: synarthrodial, amphiarthrodial, and diarthrodial. When you say synarthrodial, these are immovable joints, non-movable. Amphiarthrodial, slightly movable. Diarthrodial, movable. Okay? Again, synarthrodial, immovable. Amphiarthrodial, slightly movable. diarthrodial, movable. Most of our joints in our body are diarthrodial. Di ba? Your wrist, your elbow, your shoulder, imo neck joints, imo vertebra, okay? Imo knees, hip, okay? Ankle joints, movable. Okay? So most of them. Pero there are also immovable joints. Like your synarthrodial joints. I gave you an example kanina. Right here, we'll go back to the top here. Sutures. Sutures are immovable joints. They are made for stability lang. They cannot be moved because, again, to protect your brain. Your brain is inside. Ha? So, if your joints here are moving, it imo brain masasabud or madadamage. Okay? When you're nodding your head forward, or let's say na rantok ka, or you're na headbutt. Okay? So, dapat stable lera. Okay? Sutures. The next type is the amphiarthrodial, the slightly movable. Okay, so an example for a slightly movable, meaning it's slightly movable, they only move on certain instances. Okay, they don't move all the time, only if they are needed to move. Okay, for example, your symphysis pubis. Symphysis pubis is a joint between the pubic bones. So ito nga area nga nagko-connect dinhi, ito man connection man ito, that's a joint, that's the symphysis pubis. Okay, now that is a slightly movable or amphiarthrodial joint. Okay, kaya this only moves during delivery of a pregnant woman, okay, babae nga nanganganak. So of course the baby will go out of the pelvic outlet. This hole right here is the pelvic outlet, dito nagawas it baby. So the symphysis pubis during delivery will relax and will allow slight movement para easier ang pag-deliver hen baby. Okay, so that's an amphiarthrodial joint. Only moves when it is needed. Okay, pero most of the time that will not move. Okay, and lastly we have the synarthrodial. As I said, most joints in our body are diarthrodial, or not synarthrodial, sorry, synovial or diarthrodial joints. Okay. So we have different types of diarthrodial joints because there's so many. Okay, we have the non-axial, uniaxial, biaxial, and the triaxial. Non-axial nga ni non-axial waray axis. Uniaxial nga ni one axis. Biaxial duhang axis. Triaxial tulo na axis. So the non-axial synovial joints. Okay? Examples are your carpals and your tarsals. Ba carpals din eh. Carpals. When you flex, extend your wrist. There are nakamot flexion, extension. Flexion is decrease the joint angle. Extension is increase the joint angle. Ba? Right? So that's your what do you call this? Flexion, extension. And this is ulnar and radial deviation. When you say ulnar deviation, that is your hand or wrist pointing to the ulna. Diba ulna may pinky side? Pinky, ulna. Ulnar deviation. Pointing to the pinky side. Radial deviation, opposite na. It's pointing to the radius. Radius side din eh. Radial deviation. Okay? So during this motion, your carpals are gliding and sliding. Nagmo-move ra. So like this. Nag-glide lang. Glide to the left, glide to the right. Okay? Kung na-flex, na-glide forward, slide backward. They don't really have an axis. They're just sliding. That's why they are non-axial. Uniaxial naman, for example, your elbow. Okay, usa lang example takatag. Elbow. Uniaxial only moves in one axis. So look at your elbow. It only moves in one axis. This is the sagittal plane x-axis. Okay? Anyway, you don't really need to understand that pa, but usa lang. Okay, look, you cannot move your elbow any other way. Di rin niya kaya mag-sideways. Ba? Di rin niya kaya mag-sudsog. This is not your elbow moving, this is your shoulder. This is not my elbow moving like this. So movement na talaga at elbow. One axis. Okay, another example na lang. Your IP. Interphalangeal. Di ba? Phalanges inera. Interphalangeal is between the phalanx. Ini nga line na mismo. So if you look here, your phalanges can move forward, flexion, extension. So, inila ha, phalanx iniya. Flexion, extension. Diri niya kaya mag-move sideways. Ini nga sideways, diri ni phalanx it na move. This is your MCP, metacarpophalangeal. The connection between the metacarpal and the proximal phalanx. This one, didi na move. Not here. If you try to move your interphalangeal like this, diri niya kaya. Ba? One axis laya. Like this. One axis. Like that. Alright? Then we have the biaxial. So, ano ang ginhatang example ng MCP? Biaxial, duha ti axis. Kaya niya mag-flex like this. This is flexion of the MCP. Nakita ka mo, didi na bend ha. MCP, nakita ko bone didi. And kaya niya mag-abduct, adduct. Abduct, adduct. Duha ka axis. Flex, extend, abduct, adduct. Duhang axis. Another example ha, biaxial, your radiocarpal, your wrist. Radiocarpal kay connection ni radius nga ni carpals. Radiocarpal it tawag. Okay, so look, kaya niya mag-flex, extend, that's one axis. Kaya niya mag-ulnar and radial deviate. That's another axis. So, biaxial. Last one, triaxial. Duduhalat triaxial aton body. The shoulder and the hip. Your shoulder can do movements in three axes. Flexion, extension, abduction, adduction, and rotation. This one, nagro-rotate niya. External and internal rotation. Same goes with your hip. Okay? That's why they're called the ball and socket. Because if you look at the hip right here, ball and socket. So, socket an imo pelvis, ball an imo femoral head. Okay? So, ball and socket. Same goes with your shoulder. If you try to draw the shoulder joint, bagat nasa iti head, this is the scapula. So, ball and socket gap. Okay, same goes with your hip. So, they can do three axis of motions. Alright? So, here, pakita lang, mga examples yan. Adin mo carpals nagsa-slide and glide. Adin mo metacarpophalangeal MCP, o connection between the metacarpal and the phalanx. They can do abduction, adduction. Also, didio flexion, extension. Manasagad dito. Elbow, uniaxial. Kailan niya mag flexion, extension. Okay? Alright. Last part. We're in the last part na. So, since our synovial joints are the most abundant aton body, they are the most known or most famous or the plentiest. Pinakadamo. Okay? May dinero parts, of course. The synovial joints has a cartilage, a capsule, synovial membrane, and a bursa. So this is an example of a synovial joint. So all of your synovial joints looks like this. Of course, they don't necessarily have the size of this bone, okay, but they have this same structure. So this one is the knee joint. Tuhod din niya. Knee. If you look at here, this is the femur. This is the tibia. Okay, but this could also be the that's the femur. This is only the knee. This cannot be the elbow because this is if this is your humerus, the radius is not as big as your tibia, and the radius will be like this lang. Tapos may ulna didi. Haimo knee joint kasi the fibula does not contribute. So bagat adire to the fibula but nasagad. Okay, so this is your knee joint. If you look at this joint, okay. Anyway, all of your synovial joints look like this. They have two bones, of course, connecting it towards so one bone and another bone, and then there's a cartilage on the ends. Why? To prevent damage to the bone, because bones are hard, diba? If they contact with each other during movement, because they're movable joint, they rub towards each other, okay, it will cause damage to the bone. So masakit, so may cartilage. Okay, cartilage. And then you have the joint capsule. That is the one that encloses the joint. Kumbaga may din niya specific space only for the joint. Okay? Kumbaga bag. It's like a bag. Tapos inside is the joint. Okay? And then in the joint capsule, the lining has a synovial membrane. The synovial membrane secretes synovial fluid. The synovial fluid is the fluid that lubricates the joint. If you can see, in nga bagat bluish fluid inside, that's the synovial fluid. So that the movement is smooth. Kaya may tubig, may fluid as alod. At the same time, the synovial fluid provides nutrition Okay? Nutrition to the joints. Okay? And then lastly, you have your bursa. Okay? Mga sac, side joints to protect the joint. Okay? So, sac. Pagbaget cushion on the outside. Okay. We're done.